So we've learned that pelvic floor disorders occur when the sling or hammock that supports the pelvic organs become weak or damaged. Now let's go through some of the main types of pelvic floor disorders. And Dr. Sirven, here are 3 specific ones. Can you discuss these?
Well, I think that when we talked about pelvic organ prolapse, as we discussed earlier, it could be 3 types of a pelvic organ prolapse. We're going to discuss the urinary incontinence, anal incontinence, and those will cause anterior defect as well as a posterior defect on the pelvic organ, but also the apex defects. The apex defects are really defects that are associated with prolapse of the uterus and the weakening of the muscles, that ligaments that support the uterus that causes this to happen. So, I mean, this is all, they're all interchanging with each other.
Right.
They're all, you're going to see that every one of them is associated with it. Now, we understand that some of these defects are isolated. A patient could have an anterior defect with just incontinence of the anterior abdominal wall and the bladder prolapsing without having a posterior defect, and vice versa. As well as you could have some type of apex defects now without having anterior and posterior. Less likely, but you will. I think it's important that as a physician, when you observe your patient, analyze your patient, you're able to determine which type of defect they have, so you could do the correction based on whatever defect the patient has.